Thank you so much, Mark, and thanks everyone for being here. Really pleased to be able to join you this afternoon to talk about this incredibly important topic. And thanks for that intro. As Mark said, my name's Sara. I work for Macmillan Cancer Support. And for anyone who thinks of Macmillan and has been familiar with our coffee mornings or our fundraising efforts, our mission at Macmillan is to support everyone with cancer in the UK get their needs met. So we're here to support people with the physical, emotional and financial side of cancer. And it's a pleasure to be here talking about this incredibly important topic. So my role at Macmillan Cancer Support is all about affecting change and making sure that decision makers across the country are really clear on what needs to be done to improve the lives of people living with cancer. And unfortunately, this last year has thrown a huge amount of disruption into cancer services up and down the country. And that's the case for lots of different health conditions, I know, but today I'm here to just talk about what the impact on cancer care has been. So using my first slide, we've got a picture telling 1,000 words, or in this case, just one graph. What this shows is, I think, a really clear example of just how significant the pandemic and its impact on cancer services has been. So lots of you might have, as Mark alluded to, some interaction or experience of cancer care, whether that's getting checked out for something yourself or because a loved one has been through a cancer experience. But what's common for everyone is that there will need to be a way in which that person gets their diagnosis. Now, cancer diagnosis can happen in lots of different ways. We know that people get screened for some cancer types, which is when they get checked out when they don't have any symptoms at all. That could be a mammogram, a cervical smear, the bowel screening kits, which comes through the post. But the most common way people get diagnosed with cancer is actually through a referral from their GP. And we call that the 2-week wait. So this graph shows what happens to the 2-week wait. So that's those urgent GP referrals in the period of the pandemic. So sort of this time last year and over the last few months. So I wanted to talk through this graph with you just because I think it shows what the challenge is now, really. That green line at the top is essentially what you'd normally expect to see in terms of the number of people in England getting their 2-week wait referrals. So those are people who've gone to their GP, said, I'm a bit worried about this lump I found, or my tummy troubles haven't gone away, or I've been coughing for 3 weeks. And you tend to see a sort of general line, which doesn't vary that much. It maybe changes a little bit around Christmas time, just because people put off going to see their doctor. But what happened in April last year is the pandemic was probably at its height in terms of encouraging, or the government was definitely encouraging people to stay at home, protect the NHS and save lives. And of course, that was the right thing to do. But I think one of the unintended consequences is that people really did stay home and didn't bother their GP with a cancer symptom. So that real dip that you can see in the blue line shows just how few people contacted their doctor and then got an urgent referral to get their cancer checked out. And over the last year, that's really added up. And we think that the cumulative total of people who haven't been referred for that 2-week wait is over 350,000 people. Now, not all of those people, in fact, most of those people don't have cancer, but we know that some of them do. So it's a bit like finding the needle in the haystack. We need to make sure that people are coming forward, seeing their GP and getting checked out for those cancer symptoms, because we need to make sure we find the 7% of people who normally get referred that way and do have cancer and need to get their diagnosis and treatment quickly. So my next slide shows the impact of this. What we've seen, as I said, is this kind of cumulative drop in people getting diagnosed. At the moment, we think that in the last year, around 38,500 people haven't started their cancer treatment in England, who you'd expect to see starting their treatment in normal times. And as I say, cancer is a time-sensitive disease. And often, as we've heard from Mark, early diagnosis really, really makes an impact. So if you just take a sort of snapshot in time, and what we'd normally see is people getting diagnosed, and some of them will be diagnosed at an early stage when the cancer is local, it's easier to treat, it could be taken out with an operation. Now, if those people haven't been diagnosed in the last year and perhaps were staying at home, not wanting to bother their GP, it might mean that they get diagnosed at a later stage, and that then leads to an impact in having fewer treatment options and potentially some of those people less likely to survive their cancer. So we're really, really mindful, and at Macmillan we've been campaigning on this for the last few months. We have to make sure people come forward, but we also have to make sure that the NHS is really equipped and set up and ready so that when those people do arrive at their front door and are saying, I need a test for something that I'm worried about, that there's enough capacity to make sure those people get tested and then get treated really quickly, because we really need to make sure that this potential impact, that excess risk of dying from cancer is as small as possible, and that means getting people seen and treated quickly. Another impact is shown on my next slide. We've been talking to people living with cancer over the last year, and we know it's always a distressing part of someone's life to hear the news that they've got a cancer diagnosis, but that has been even more impacted in the last year. Lots and lots of people with cancer are immunocompromised, so their immune system isn't as strong as it could be, and that means that they might have been advised to shield over the last few months, and that's also taken its emotional toll. So at Macmillan, we try to think about the whole person, and we try to make sure that the services on offer in the NHS and through other healthcare providers are thinking about the emotional needs that people with cancer will have. And we think those have been exacerbated, and we need to make sure that, as we say, when the NHS is getting back on track and cancer services are recovering, we need to make sure that people's emotional needs are met too. So on my next slide, I've got a little bit about what you can do, because I think it's always important to make sure people can take an action away. So as hopefully you'll have understood from my first couple of slides, there is a real impact in people not coming forward and being reluctant to bother their GP. So the NHS all across the country has been running a Help Us Help You campaign, and Macmillan Cancer Support has been supporting that throughout. We absolutely have to encourage the public to get their lumps and bumps and changes and symptoms checked out. And that's why these advertising campaigns, this marketing and all these images you can see on this slide are there. That's really encouraging people to get things checked out. We've also been advocating to decision makers, so whether that's governments or ministers in all parts of the UK, that they've got to make sure that cancer services and cancer staff are really equipped to look after people when they do come forward. And I think that's something that everyone can play their part in. You can encourage loved ones to get symptoms checked out, but you can also take part in campaigns that charities are running. And you can also make sure that if you've got colleagues and staff who might be experiencing a cancer diagnosis, that you're really supportive. Lots of resources are available from Macmillan Cancer Support, including our Macmillan at Work scheme, which is all about supporting employees who might be given a cancer diagnosis. And that means that you get webinars, expert training, and a toolkit that can be a practical resource so that you can support your employees if they're going through cancer diagnosis and treatment. And lastly, I think it's really important just to make sure that as we're thinking about cancer care, and as the country, we hope, gets back to some semblance of normality, that cancer services are equipped to build back better, just as the rest of the country is too. So beyond the workplace and looking after colleagues and friends and family, we really need to make sure that people with cancer get their holistic needs met. And that's why at Macmillan we're championing personalised care. We also need to make sure that cancer services are fit for the future. And that means really supporting the doctors and the nurses and the allied health professionals so that they've got the time and the equipment and expertise and reinforcements, I suppose, to be able to give good cancer care now, but also in the months and years to come, because as I said, it looks like the pandemic has cast a long and devastating shadow across cancer services. So we have to make sure we're going to build back better for cancer care too.